Okay, I think I'll start. Hopefully people will join us as I'm doing the introduction. Hi everyone, and welcome to our ARC Northwest Coast Seldom Heard Forum. Those of you who have joined us before probably know we're a team of Ruth, Selena, myself and Shema, who's on maternity leave at the moment. Today's Seldom Heard Forum is a packed agenda, and it's about the Chinese community. Just some quick housekeeping. Please remain on mute unless you're presenting, and use our Twitter tag, which is ARC_Northwest Coast. We have a chat function, so if there's anybody wants to put anything in the chat, please use the chat, and that is for questions as well. For the beginning, we'll just be using the presentations, and then we will let you know when you can directly ask the speakers. As you know, our Seldom Heard Forum brings together health and social care providers, public advisors, to support the development, delivery and implementation of research into practice. And our vision is to improve health equity and applied health research through the voice of the population. The Seldom Heard Forum has been going on for over a year now, and it creates an environment where ideas and views that reflect issues and needs experienced by seldom heard groups and communities can be exchanged. And our aim is to bring together representatives of seldom heard groups from across the Northwest Coast. It's an opportunity to share issues experienced by the groups they represent and share good practice, and then discuss how best to enhance inclusion in applied health research to address these issues. The Chinese community in the UK, this has been settling here since the 1800s. The demand for Chinese food increased in the 1950s, and the collapse of Hong Kong's agriculture sector led to more Chinese people coming to the UK. In 2021, there were 502,2106, that's over 500,000 people of Chinese ethnicity in the UK, which was 0.8% of the total population. The Chinese community is one of the most geographically dispersed ethnic minorities in the UK. They are established Chinatowns. These are established Chinatowns in London, Birmingham, Manchester, Newcastle, and Liverpool. Our first speaker is going to be Di Burbridge of the Chinese Wellbeing Community. Is that right? From Chinese Wellbeing Service in Liverpool. Di, if you would like to begin, and you can start sharing your slides. Or is Ruth going to do
I'm going to share the slides for us.
Okay,
Thanks, Ruth. Thanks, Ruth. Thank you.
I'm just trying to get them up. Hopefully you'll be able to see them.
Please do use everyone the chat function for any questions, and then each speaker will get back to you directly through the chat at the end of their presentation.
Okay, can you see those? Yeah.
Thanks, Ruth. Thanks, Ruth. Good morning, everyone. My name's Di Burbridge, and I'm the Chief Operating Officer for Chinese Wellbeing. Before continuing, I'd just like to thank Selena. I'm not sure she's on the call yet, but I'd like to thank her for the opportunity to present today. We're a small Chinese charity working with the community on Merseyside. And for those that aren't aware, Liverpool is the oldest Chinatown in Europe. I've been asked to talk about our services, and particularly those that are focused on improving mental health and well-being. And so I want to go back to our roots. We were established in 1989 when a group of young Chinese volunteers came together with a vision to improve job opportunities and training in Chinatown. That was the birth of Merseyside Chinese Community Development Association, as it was known then. Chinese Wellbeing, as we are now known, is a vibrant charity of 17 dedicated staff, 3 volunteers, and over 200 service users. Our mission? Well, it's been to enable independent living, promote physical, mental, social, and economic well-being, reduce social isolation and loneliness, which we know can have a detrimental impact on physical and mental health, support community involvement and connectivity, which is very important, and provide information to clients and advocate for their needs. I think we've already gone on to the next slide, haven't we, Ruth? Okay, our client profile. Primarily Chinese, age 55 to 94 years, the majority falling within the 60 to 79 age bracket. They have very specific language and cultural needs that are varied and complex due to differing health beliefs and systems. And many live with physical disabilities and long-term health conditions. Liverpool's older Chinese community are migrants from Hong Kong, as was Naheed mentioned in the very beginning of the slides, who came in the late 60s and 50s seeking a better life, usually in takeaways and restaurants, working long and unsociable hours in takeaways. This came at a cost. Many found themselves socially isolated, with little time to learn English and even improve their Chinese literacy. They now face complex health challenges, and accessing mainstream services can be problematic, especially if they have absent children or live alone. That's where Chinese wellbeing comes in, and we provide the much needed support to address these issues. Next slide, please. So, our founding members supported the King's Fund back in the early days in what was one of the first studies into the needs of the Chinese living in Britain. This early research gave valuable insights, and in particular to the needs of family carers and the pressures arising from social, emotional, physical, and financial aspects of their daily lives. As a result of this research, MCCDA set up the Chinese Carers Network, and the support services included advice and counselling, respite care, recreational activities, support in accessing mainstream services, and educational programmes. This laid the foundations for the services that we continue to provide today. In 2009, and you'll see on the slide, we were involved in a study which was led by the University of Central Lancashire, and it was part of the Delivering Race Equality in Mental Health Care, which looked at the mental health experiences of Black, Asian and minority ethnic communities in Liverpool, which included our Chinese elders. The findings showed a commonality between all groups, and the recommendations from the study included provision of information in community languages, access to mainstream support through community-based support, and improvements for how care is explained, planned, delivered and followed up. And we're very proud to say that since 2009, we've facilitated subsequent consultations and engagements around mental health services in the community. And sadly, things don't always appear to have improved. Next slide, please. This was my attempt at being creative, rather than just do a long list. And apologies if it's confusing, but these are the key learnings and barriers to accessing mental support within the older population. So there's many diverse approaches to health. Many diverse approaches to health and illness. There's complexities that can arise in cases where Western treatments are combined with traditional Chinese medicine, limited English language skills and little experience of communicating with the rest of society. There's a community in Liverpool is very dispersed, and it was originally to avoid competing with other Chinese businesses, which has left people isolated, particularly following retirement. There's a lack of knowledge of what is generally available under mainstream health and social care services. There's stigma and shame attached to mental health problems, and this often leads to late presentation to mental health services. And back in 2011, CQC actually reported that the Chinese were probably the highest of all Black, Asian and minority ethnic communities in terms of numbers presenting late. I don't know whether that's changed over the years. Probably not. There's also a fear of losing face if this becomes common knowledge within the community. And there are genuine concerns about local interpreters not always observing confidentiality. And this leads to a great reluctance to seek help outside of the family. Due to the difficulties as well in expressing health concepts from their own cultural perspective, there's a preference to be seen by health professionals from the same background and cultural understanding, particularly where mental health issues are concerned. Many believe that this would be beneficial to engagement and ultimately to their treatment plan. And no matter what health consultation we are engaged with, that point comes up on every occasion. There's a lack of awareness and understanding in general of the signs and symptoms of mental health problems and how mental health issues can actually manifest into physical symptoms such as lack of sleep or loss of appetite, again leading to late presentation. And many of the older population that we serve have very low expectations of their life in the UK. Next slide, please. I seem to be missing a title there, but never mind. So mental health support programs that we have introduced over the years. In 2013, we had funding from the Lankelly Chase Foundation, and we appointed a dedicated mental health lead. She had a professional background in mental health and was the program was a 2-day-a-week program. So what did this do? Well, we were involved in awareness raising of common mental health problems across the community, and each year we reached around 300 people. We delivered cultural awareness sessions to healthcare professionals to improve cultural competency. We're involved in independent advocacy, and several members of the staff team were trained in independent advocacy. We had one-to-one crisis support to individuals and the family members, and we had a direct referral pathway to talking therapies. Now, this was met with a lot of reluctance and resistance, given the issues I've already outlined around stigma and shame. And with encouragement and support, we were successful in making referrals into the service. However, sadly, most did not complete the course. Lankelly Chase changed their priorities after the 3 years, and we were not successful in our efforts to secure further funding to continue the service, despite the successful outcomes we achieved. Next slide, please. So, in 2015, with funding from the Lloyds Bank Foundation, we launched what we called our Transitions Project. And the project was aimed at the over 55s experiencing life transitions, causing them trauma and mental distress. The crisis situations ranged from a diagnosis of a chronic health condition, bereavement, financial hardship, moving to sheltered accommodation and residential care, adapting to disability, and unsafe living accommodation. Next slide, please. So you can see on the screen there a list of the outcomes from those people that we supported. I'm not going to go through the list, you can read them there, but needless to say, our interventions were proven to significantly improve mental well-being, as evidenced by the outcome star framework for older people that we were using at the time to monitor and evaluate the project. And of course, we did get a lot of client testimonials. Thank you. Next slide, please. So our approach today, and here's a collection of photographs here. You can see our Nordic walking there, which was part of the Green Space project, which was funded through the Green Recovery Challenge Fund via the Liverpool CCG. All of our activities and our services are developed around the 5 ways to wellbeing. And I'm sure everyone on this call knows connect, get active, take notice, learn something new and give. And all of those things are a constant reminder whenever we put our banner stand up, which is you can see in the background photograph there. And we develop our services always in consultation with our members. Our Evergreen Club provides a range of activities and they include anything from crown green bowling, Nordic walking, as I mentioned, pom-pom dancing, singing, arts and crafts, games, healthy eating, day trips and cultural celebrations. We work very closely with Liverpool Public Health as a community champion organisation, and we deliver health talks on topics including mental health, cancer, heart disease, brain health, dementia and immunisations. And during COVID, we transferred our activities online. Took a lot of patience from the staff team because many of our older members had not used Zoom. We taught them how to access Zoom and we introduced a tablet loan scheme to reduce digital exclusion. And this service still continues today. And even though when services went back to normal, many of our members enjoyed accessing online activities because they can do it from the comfort of their own home. So for those that are most isolated, it helps them to stay connected and participates in weekly activities such as Love to Move and arts and crafts. And during COVID, we also identified a need to provide welfare calls, which quickly became a lifeline for our most vulnerable groups. And again, we continue to do this. And just by way of example, for the year ending March 24, we delivered 140 activity sessions, including 12 health awareness sessions. We had 2,500 attendances and we made 5,500 welfare calls, texts, home visits and emergency shopping trips. Next slide, please. We're currently funded through the NHS Health and Wellbeing Fund to provide culturally appropriate dementia support services. Led by 2 dementia leads who are experienced nurses from Hong Kong. The services include one-to-one support. We have a tea house reminiscence, which is everyone, provides for everyone, and it provides culturally appropriate activities, including memory box. And we've spent many, many years, since 2012, collecting memorabilia, which we use in our reminiscence and memory sessions. Dementia, we have a dementia network as well, which is for people living with dementia, MCI, and it's also for their family carers, which need a lot of support. You can see in the slides here, we hold Love to Move sessions every Wednesday online. We have 2 licensed practitioners. And the programme, for those that don't know, this programme originated in Japan. And it was further developed by the British Gymnastic Foundation and has been proven to improve cognitive functioning. And I have to say, it is very, very popular with our groups today. You'll also see in the slides here, when we delivered with Merseycare's post-diagnostic support service. The programme we developed with Merseycare to ensure it was culturally appropriate for our audience. It was then translated and all the sessions were delivered in Cantonese by our experienced dementia leads. And you can see we can't show, for obvious reasons of confidentiality, the group that attended because the dementia network is totally private. We don't take photographs of anybody that's participating in the network. But I have to thank Emma Stafford, who's the Dementia Care Navigator lead, who you can see in the photograph here, who led on the work and who we worked with very closely for several months. The feedback at the end of the 7 sessions was very, very positive. Next slide, please. And this is can't leave without showing our choir. And you can see in the photograph there our trustee, Dr. Xiao Xiaohu, who is a dementia researcher and who accompanies the choir on the guzheng. And the choir has performed many, many times in public, and they love doing it. So we're there, we're here. If you need somebody to entertain you at any future events, please knock on our door. Next slide, please. So finally, I just wanted to cover a very, very important service that we are funded by to deliver through the Independent Age. We have funding for a further 3 years. And what we all know is that in our experience of delivering support to those with mental health problems, financial worries are often the root cause of stress, anxiety, and depression. So this cost of living service, we can provide guidance and support with welfare benefit claims, advice on reducing energy bills, grant schemes and registering for the Priority Services Register, signposting to other agencies, advice and guidance on accessing adult social care, including the Carers Voucher Scheme and direct payments. We are experienced in this field because up until last year, we were a care provider commissioned by the City Council. Support to access safe and secure housing and independent advocacy support, interpretation and outreach support for those with mobility issues. Thank you. Next slide. So thank you for listening, and thank you as well, I should say, to our funders, which you can see in the slides there, and look forward to any questions at the end of all the presentations. Thank you so much, everybody.
Thank you, Di. That was absolutely amazing. And as you heard in our beginning, one of the things that Seldom Heard Forum does is raise awareness of organisations and the services that they can provide. So hopefully that has been very helpful for our audience. We'll go straight on to our next speaker, which is Eunice. Eunice, are you ready? And Eunice is from the Wolfson Centre for Personalised Medicine at Liverpool University. Thank you. If you've got any questions, please do use the chat.
Hi, everyone. Can you hear me okay? And can you see my slide? Great. Thank you very much. So, thank you very much for the invite. It's a great pleasure to be involved in this forum. And before I start, I just want to say thank you to Di, for such a great presentation. I really enjoyed it. And it's amazing work that you're doing, Di. And it's great to see you here again. Just to give you an overview of my talk, I'll start off by giving you a brief account of my personal history and how I ended up in Liverpool. And I would like to take this opportunity to speak about a research study I'm currently working on, which is called the TPYD International Study. Okay, right. So in the late 19th century, my great-grandparents immigrated from Southeast China to Singapore. So Singapore is where I was born. If you haven't guessed it from my accent. Singapore used to be a British colony, and it gained independence about 60 years ago in 1965. So Singapore is a relatively young country. You may have seen videos and adverts about Singapore, and Singapore is actually very well known for its clean and green urban oasis. And this is largely due to the ban of littering and the ban of chewing gum in the early 1990s. So basically, offenders caught littering will be issued penalty fines, and chewing gum is basically not sold in Singapore to this, to date. But in 2004, the government allowed the use of chewing gum for dental therapeutics, as well as nicotine chewing gum. So in Singapore, it's a multicultural country. So we've largely composed of 4 ethnic groups, got the Chinese, Malay, Indian, and Eurasian. And you can imagine, with such cultural diversity, we've got lots and lots of good food. So Singapore is a food paradise for foodies like me. So in terms of education, I did my primary and secondary education in Singapore. English language is the first language in Singapore, so subjects are taught in English. We will also need to do a compulsory mother tongue language. So, you know, being a Chinese, I will have to take Mandarin as my mother tongue. And if my Malay or Indian peers, they will have to take, you know, Malay and Indian language as mother tongue in school, which is compulsory. And upon completion of my O-levels, I was offered a partial scholarship to undertake A-levels in Oxford. So that's when, you know, my journey to the UK started. So I started off in Oxford, did my A-levels in Oxford, and then I went to London to do my undergrad degree in biochemistry. And I went to Manchester to do a master's in neuroscience. And then I was offered a research position in Liverpool. So that's how I ended up in Liverpool. So I've been in Liverpool for over 10 years now. And this is the department where I work. So I work at the Department of Pharmacology and Therapeutics within the Wilson Centre for Personalised Medicine at the University of Liverpool. Our main work focuses on how medicine works and how our body responds to medicines. And the main research I do focuses on pharmacology and genetics. So a term called pharmacogenomics, so basically how medication works and how genetic influence the drug. So how drug works, how your body reacts to drug and how the body affects your body. And we are focusing on side effects to medicines. So before I go on to talk about the research study I'm working on, I just want to mention that, you know, since I arrived in Liverpool, I've been engaging with the local Chinese community. So I've joined the Pagoda Arts. So I've started learning the Chinese How to Guzhen. So this has gone on for quite a few years, and we did public performances around the city as well. So I was very engaged before COVID, but when COVID came, you know, all classes were stopped. So, you know, I couldn't continue. So this is something on my list of things to do that I would like to continue moving forward. Right. And then coming back to the research project I would like to tell you about. So the title is called DBYD International. So we want to improve the use of genetic testing to reduce side effects to a group of chemotherapy medicines called fluoropyrimidines. So I'm going to use the short form FP from now on. What we really want to gain out of this particular study is to reduce the side effects to chemotherapy drugs. So what's fluoropyrimidine chemotherapy medication used for? So it's used to treat a variety of solid cancers, including colon, breast, throat, stomach, head and neck cancer. And there are three drugs that fall under the fluoropyrimidine group. So we've got the intravenously given 5-fluorouracil, and we've also got the oral form of capecitabine and Teicofa. So these drugs are very effective for chemotherapy, but they cause severe side effects. So about 10 to 30% of patients prescribed with fluoropyrimidine are likely to develop severe side effects. Some examples of these severe side effects are bone marrow suppression. So basically the bone marrow don't make enough blood cells. So that means then the patient will have very low immune system. And they can suffer from very severe diarrhea. So they can get continuous watery diarrhea with severe stomach ache. And they could also suffer from mucositis, which is the inflammation and damage of membrane linings of their mouth or parts of their digestive tract. So this can be very, very painful. And they can also suffer from hand-foot syndrome. So this is a skin reaction, redness or swelling of their palms, of the hands, or the soles of their feet. And sometimes, you know, when it gets so bad, they can feel burning sensation with extreme pain. So these severe side effects can lead to mortality in up to 1% of patients, and it can lead up to mortality in the elderly at a higher percentage of 5%. So what's the cause of fluoropyrimidine-related side effects? This is largely due to a gene called TPYD, which codes for an enzyme called dihydropyrimidine dehydrogenase. I wouldn't go into too much detail here because it's just too scientific, but this particular enzyme is produced in the liver, and it helps to break down the chemotherapy drug in the patient's body. Now, genetic changes in this particular gene means that the patient will have decreased function of that particular enzyme. So that means that they will have a buildup of the chemotherapy drug in their body, which means then they are prone to side effects. So there have been a lot of studies that have been conducted in the European population, and the NHS get all this information, and they commission the genetic testing of TPYD gene in November 2020. So these are the 4 variants that are currently being tested. So what happened is the patient requires chemotherapy drug. What the oncologist will do is they will do a genetic test. So based on the genetic test results, if they test negative for the 4 variants, then they will be provided standard dose of the chemotherapy drug. But if they find genetic changes in one or all of the 4 genetic variants, then there will be either a dose reduction in the chemotherapy drug, or the oncology will prescribe a different chemotherapy drug to the patient to try and reduce the incidence of side effects. Now, there is a limitation with this current test that's being implemented by the NHS, because all of these 4 variants that are currently being tested by NHS are commonly found in the European population only. So what about other ethnicities in the UK? So, for example, the Chinese ethnicity. So because they are not being tested, testing the 4 variants means that most likely patients of non-European ancestry will be tested negative on this particular test. So no genetic change will appear from their genetic results, and they'll be given standard dose, and this will predispose them to side effects. So what we are hoping to do as part of our study is to recruit patients internationally to look at genetic factors across all different types of genetic ancestry, so all types of ethnicities, to try and improve this genetic test, because in the UK, being a multicultural country where we have different ethnicities, we really need to reduce health and race inequalities. So hopefully this will lead to safer treatments for not just the Caucasian patients, but patients of all ethnicities, and this would decrease their hospital stay and optimize the health services. So this is one of the examples of the research study I'm working on, and this is one of the reasons why I'm still here in Liverpool, because all these research studies I'm currently working on is so interesting, and it's especially in this TPYD international study example, because personally, I feel this is a good cause where in terms of healthcare, we really need to start looking at the whole world in terms of encompassing all different ancestral populations. So here I just want to thank the TPYD international team. So without them, we wouldn't have progressed much with this particular research study. And so thank you very much for your attention. That's the last of my slide. I hope I've kept to time.
Thank you, Eunice. No, you have. We were a few minutes late starting. That was an amazing presentation, and hopefully you'll get some recruitment as well through your presentation from the diverse communities that we represent. Thank you very
Thank
much.
you.
Any questions for Eunice, please do put them in the chat. We're going to go on to our next speaker, who is Desmond Chow. Hi,
Hello.
Desmond. So Desmond I've known for over 30 years, I think now. So we're both what you would call capital of culture ambassadors. There's some background noise coming.
It is. I'm just going to move to another room because I'm in
Okay.
the auditorium. So let me just move, and it's only just 10 feet away.
Thanks for that, Ruth. So as you can see, Des is a BBC One, which stands for let's have a look, a British-born Chinese first generation. Okay, Des, over to
Lovely.
you.
Thank you. Hopefully you can all hear me.
We can.
And thank you for the invite and everyone else who's speaking, and also for everyone who's joined on. It's really important that we share everything we can hear and see today. And hopefully some of the slides that I'm going to share with you is very personal. So they might be very personal to me, but hopefully you can get some of the things that might help some of the other generations that are coming through. Di's talked a lot about the older and elder, but there's obviously they're the sort of sandwich generation that we need to help and support. So this is where I will be start talking about, and hopefully you can get parts and bits from it. So my life story is not far from here, which is Liverpool Chinatown. So this was this year, and we saw Year the Dragon going out, and here's the big dragon. My mum and dad's restaurant is down at the very bottom at the left. That we left there in the late 70s, but this is where I grew up. And the next picture, if you can just go in, is the year where it'll be Year of the Snake, but we haven't got any pictures of snakes going out underneath the archway. So when that's leaving, we hopefully will have another dynamic and a more resilient year, because obviously dragons are very fiery, and hopefully with a snake it'll be more calm and intuitive. So we do take the best characteristics of every animal. So that's our year there. So next slide, please. So this is a little bit about me, and is everyone okay with the pictures and the sound as well? Just double
Yeah, we
checking.
can see.
Oh, lovely. Okay. So I was born 1966 in Liverpool, so I'm 58 now, which is a bit scary. And my mum had my big brother at Sefton General, which is now Asda in Smithdown Road, but she was a nurse and didn't have a good time, and there was lots of cultural inappropriateness, so she decided to go somewhere else, which is called Lord's Hospital, which is now Spire, which is a part of the private side of the health service. It does a lot of the NHS additional services as well there. So that's in South Liverpool. So I've always been brought up in the south end of Liverpool, where we consider it maybe a bit more diverse and a bit more dynamic in that area. So I and my family, we've all grown up in the south end, so it's always been very welcoming, and Liverpool has been a brilliant place, but also very I found very quite divisive and racist in parts as well. And so that could happen in any big city and place in the world. So this is my school, and this is really interesting for me, and hopefully can share with you. So I speak very well, but I had really difficult times in school. So in Mospit, when I was growing up, and I found this really difficult, and I'll explain it in a moment, but I was always put in the bottom class, on the bottom table, on the last chair. So out of three classes, I was always thickest kid. I'm sorry to use all the terminology in the year. So my brother, who's a big brother now, and he's a doctor, all the schools going, why is Des always behind? Why is Des doing it? But obviously, here's all the stereotype now. He's doing very well. Sorry, he'll work very well, because the Chinese always do. They're always resilient and they're always diligent. And I was like, oh God. So I just had to fit in. And that's when the start of you're thinking of masking and resilience and adapting and trying to help yourself all the time. And this has always been through all my career and my personal life. So from there, because I wasn't doing very well and I was put in extra additional classes, I was very naughty, I just rebelled even more. My mum realised then, and she was a nurse, and my mum and my dad had a catering business, which I'll explain in a moment. They put me to Liverpool College, which was a fee-paying school at the time. And it was wonderful because they treated me as a whole person. It was very, very different in the way. And because we were a customer, they had to make sure I was included. And I just felt so empowered and so grateful and enjoyed it that I managed to get into Blue Coat to follow my brother, which is a grammar school. So I wouldn't have got this without the help of my parents. But I also still had difficulties. So I didn't do very well in my A levels. And I went to Sunderland Poly, moved over to Newcastle, and then finished at Liverpool Polytechnic with a degree. It took me about 3 times to get my degree. And I went to do a master's at Liverpool Uni. So on all these things, I always wanted to know why I was so bad. So I did a dyslexia test at 32. I had severe dyslexia, but it wasn't invented in the 80s. So that's why it wasn't recognized. And now it is very much so. So in that time, I came back to Liverpool, wanted to work in Liverpool, dead proud of being a Scouser and a BBC. And but I couldn't find a job, but I was doing lots of little small-time jobs. Didn't want to go in catering. My mum and dad finished that. So I decided to go to Japan. So I felt really good and bad about that because I felt like I left and betrayed my mum and dad who've moved over from Hong Kong and Canton to come to England, and I'm leaving. I'm going to leave them. So I felt so guilty, but I had a brilliant 2 years. But when I came back, I knew I had to come back to settle down and see what I can do. So then I worked in charity, public sector and the NHS. And I also wanted to put in, I'm supporting Everton FC. So I'm also still a minority in all sorts of respects. So that's my sort of lifestyle and CV, if you want to call that. So there is the next page, if you don't mind. So this is my mum. She was only 16, came over from Hong Kong, took a month to go through Malaysia, Singapore, Sri Lanka, which was Ceylon then, through Egypt, all through all the pink and red parts of the empire. So she's only 16 and so resilient, and I'm just so proud of her. And she's still alive. She's 88 now. And then the next page is some of the horrific uniforms that you can see. So if you see any of your colleagues in the NHS or friends, tell them they're very lucky they didn't have to wear any hats or work with nuns like that. So that's just a little funny one of my mum. And the next one, and that's my dad, who is also still alive. So I'm very, very lucky. And there's my brother, and there's me. So my brother, 4 years older than me. So that's my dad. And my dad went into catering. He came as a cleaner, and he opened a chip shop. And we followed this stereotypical, you know, work hard, do work, you know, and it sort of fell upon me to do the same. But as parents like that, a lot of the first immigrants, if you want to say it, or economic migrants who came in, wanted their children to do well. So they obviously helped us do the educational side of it, which was probably the most difficult thing for me, but obviously I followed suit as a chow and part of the culture. Next slides, please. So this is me growing up in the 80s. I rebelled a lot because I didn't fit in. We were when we had the restaurant, we were in Chinatown, so we knew everyone. We don't know anyone now. When we had the chip shop and the takeaway, we lived in Wavertree in the suburbs. So again, what Di was saying was very true. You just had to merge and be resilient and get on, and that's probably why the Chinese community is looked upon as oh, look at how that group of people have settled and worked well, but behind the scenes, it's very isolating, and you know, the racism and the indirect racism that happens when you're out there. But you do feel that you're an ambassador for the Chinese community, and you see that in the Chinese New Year. You see so many goodwill, and I think hopefully I can keep this going. So that's me when I was 18. I had rebel hair and long hair, and that's my brother and my dad. So next slide, please. This just showed you a picture of the last of us now. So there's me on the right. It's my mum now. I've got my son Isaac and my daughter Olivia, and they're doing brilliant. My son has followed in blue coat, and my daughter is such a sporty woman. She's absolutely brilliant. And my dad, he's still about and still active. But I'd like to tell you about how difficult it is for them, as we've looked at all sorts of generations. So just looking at that family, my two children ask me all the time, who are we? What are we? What do we call ourselves? And I just said, whatever you feel pleased and best at. When I was growing up, to get away from any awkward things, I would say I was a Chinese Scouser, and everyone loved that. If I would say I was British, I'd say, people say, no, you're not. Where are you really from? If I said I was Chinese, what are you doing here? So it was the best thing to use a Scouse humour to settle that in. And then for my parents, my mum was a nurse for 50-odd years, and then when she retired, she was doing interpreting for the council and for the community, and did lots of help. But now she's quite isolated and got dementia, but she won't use any of the services, just like me, because we feel that we're resilient. We never needed help. We don't need help, but we really do. All of us need help, but we don't reach out, or the services don't reach us, and it doesn't match. So that's our family picture. If you get to the next slide, please. This is my brother, which is really sad, because he was an oncologist, and he only died 2 years ago. So he was brilliant. He lived in America. He's my brother in the white, and there's his children. And it's just a sad time. And it made, as everyone's been talking about, mental health is so important. So I reached out, and I've got support now, but it took a long time, because I thought I was resilient, I was educated, I had all these things around me, I thought I was solid, but I wasn't. And it's important to find out the services and get the services right for the individual. So that's my brother. So the next page I just wanted to say is just be kind. Be kind to each other, be kind to everyone, find out a little bit more. I got COVID. I don't know if you want to put the picture up, Nahid, on my face, sorry, now, so everyone can see it. So yes, so when I was growing up, I didn't know I had dyslexia. So I was 32 when I got dyslexia, and then I knew something was still not right. I still found things, work and professional and personal life, very difficult. And I don't know whether it was the culture clash, things that have reminisced or come back to me, and I found really hard with cultural clashes. So I went to my GP and asked if I could get an ADHD test and an autism test. So it took 2 years, and I have got ADHD, which I was 57 years old, and I'm still waiting for my autism test, which is probably another few years. So that sort of gave me labels which are really useful to explain how life and life stresses are always there, but how difficult it was for me to reach out and find out things. So I'd just like to tell you about that. My mum and dad just been brilliant all the time, you know, and I always feel a bit guilty that I should have done better, and you do really feel guilt that but my brother was a doctor, but they always wanted me to be this and that, but they were kind, they weren't too harsh. But I've seen a lot of my peers when I grew up in the 80s that I don't see anymore, because a lot of the Chinese moved away from Liverpool to Manchester and London, and the population, like the Jewish population, really shrank very quickly. And now we're seeing a lot of younger, new students, younger mainland students coming in and settling, which is brilliant. So hopefully they'll fill the gap, but hopefully the Chinese community will be here and still can contribute. But it has been a very difficult journey, but also very rewarding. And I'm always grateful that I've mum and dad had a chance, and I've had a chance to try and contribute and help. So that's why I work in NHS now, and I always try and speak to people at a level that is appropriate to them, and finding things, because I know how difficult it with the subcultures that within the Chinese community, because not everyone fits in. And just like everyone I can see on the screen there, we've got so many different diverse people in here, and not everyone fits exactly right, and it shouldn't be as well. So we just have to be mindful of cultures and subcultures, and finding out what's right for people. And that's my mantra, and hopefully you've all got something out of this. And I'm always grateful for the NHS to give my mum a career, my brother a career, myself a career. I survived COVID. I was in hospital, got COVID again before all the shutdowns. So I was one of the very first, and I was 6 in the country to get the second time round. So I'm very lucky to be here. So I want to just say thank you, and hopefully you've got something out of my personal journey, and you got bits out of it. Thank you. Any questions?
Thank you, Des. That was really, really emotional, and thank you for sharing your story. And there's a lot you didn't say, but I've known Des a very, very long time, and he's a capital of culture, which was 2010. So he's always represented the Chinese community in a very positive way. He's a health ambassador as well. And there's so much that he does do for the community, but not only the Chinese community, but all communities. He's the face of Liverpool Women's Hospital. But that was, it was an amazing personal story, and thank you so much for sharing that, Des. We're going to, if we've got a couple of minutes, if anybody would like to ask any questions, we could just shorten our 15-minute break to 10 minutes. Is there anyone who wants to ask anything quickly while I'm giving you the chance?
Anyone? Des, I was going to ask you, I thought it was an amazing talk. Thank you so much. And I put in the chat, I was wondering as you were speaking whether you were going to say about the ADHD, because you sounded so much like my son, who has had similar issues. Do you feel like your children have been better supported in school than your own experience?
Yeah, I think the education system is a lot more well-rounded and more awareness. So they tell me about LGBT issues, which I know from work and things, but I'm just going, wow. I'm so glad you're hearing about different faiths, cultures, and celebrations. So there's a lot of things more going on. There's that's they say to me, you can't swear, you're inappropriate, you shouldn't be doing it. And I can't see telling them to say, oh, it's me ADHD or me autism, but they sort of get it. But then when they listen to it in a classroom and with their friends, and the mix, and amazing that they have their friends, because when I grew up, I didn't have any Chinese friends apart from when I was in Chinatown. And then when we had friends who had to leave or go, or they married, had different, relationships with different cultures and communities, a lot of my friends had to move because there was that old tradition you should marry within the Chinese. My mum and dad were fine, but the diversity now in Liverpool and big cities is fantastic. I always remember in the 70s and 80s when, just quickly, the Vietnamese, when they came over in boats, and they were called the boat people in the 70s and 80s, and they were spread, as you've heard, geographically all over, and they came in, how they had a tough time as well about gelling in, and no one sort of helped them. So I've always remember when I grew up, they were doing all the menial jobs, and we were already doing that before. And now we've got catering. And now we've noticed the Vietnamese are doing more of the business type. And I think each generation comes down at the very bottom, but has to work hard and come in. Liverpool gives you that chance. And I think people Liverpool, because it's such a republic and such a, a diverse, I think we all help each other. We obviously see small minorities, but it's a brilliant place, and I'm always thankful to be a Chinese Scouser. And I do have a cast on my arm because I fell over, sorry. So thank you for the question, and hopefully you got something out of that, Selena. Thank you.
Yeah, that's
Thank you
amazing.
very much.
Thank
Yeah,
you,
thank
Des.
you. Thank you, Des, and thank you, Selena, for speaking to Des. We're just going to take a quick 5-minute comfort break. Hopefully it will be enough for you to just use the washroom and make a cup of coffee. If we can all get back at 12:05, please. Thank you. Just switch your cameras on when you're back. Thank you. Hi, everyone. Welcome back. Our next speaker is Hannah Burnett, who is from the oh, it's not Hannah, is it? Where are we? Speaker 4.
It's this from the students from the Liverpool community.
Right. Okay.
Students.
Yeah. It's the Liverpool Chinese Students and Scholars Association, which is LCSSA.
Yes, and I've already shared my screen. I hope everyone could see it. So
Yes,
thank
we
you
can.
for thank you. So thank you for all for inviting me for today's forum, and I'm happy to see many new friends today. I have to say that I tried to add my names in the Zoom, but I failed. So I want to type my name in the chat, and you can also see my name on the slide. So I'm Yu Chen, and I'm currently a PhD student in the University of Liverpool and the president of Liverpool Chinese Students and Scholars Association. It's quite a long name, so normally we will be called as LCSSA. So we are basically a non-profit and volunteering Chinese student society, and our members or our events are covering majorly the most Chinese students in different education institutions in Liverpool. Our daily job is to enrich the daily life of the Chinese students, bond our group, and try to introduce the Chinese students, Chinese culture to all other group and people in the UK, and also try to build a bridge or platform to let different group and different angle to can have a talk together. So we founded in 1988, and this is some example of our events that we held in the recent years. So the picture in the right top is our 35th anniversary that we held in the 2024, and the picture here in the left bottom side is our newest or the latest event we have is the Chinese Spring Festival Gala, which we invited many Chinese students performers to give a dance and singing and different kind of shows to the students and audience, to different people and guests. And the picture in the left top is the pre-departure briefing that we held in Shanghai in last year. So this is one of our major events because many students, even though the social media is quite popular in these days, and you can find many information or the guidance about how to live, how to study in the UK or Liverpool in the internet, but it's still a little bit different between watching a picture or video and you standing in this land to experience with the real country or the real university life. So we try to give some experience tips or some guidance to these students as the students who have learned here before, to share some ideas about how it's like living here and what kind of the university be like and what will you experience and maybe any challenges before you come to UK. So this is our major event and task for each year. And besides that, we also have many different other type of events like the Dragon Boat events. This is what we participate in the Lord Mayor charity Dragon Boat race in the 2024. And this is the event or the small booths we have in the Chinatown this year, this February, as a part of the Chinese New Year celebration in the Chinatown. There are many students or many like kids loving our Chinese calligraphy and the paper cutting event or activity we held at the day. And we also have some collaboration with many different organizations or institutions in the UK. This is one of our representative events we held also in the last November. So the NHS CPR team, they want to introduce the basic knowledge and the skills to the Chinese student about how to do the CPR when you need to help other people. So we work with the NHS to have this kind of special event to the student. This is very special because I think for myself, I come to the UK in 2016. So before that in China, we didn't receive this kind of training. We do receive some training through the video or through the picture before, but this is the first time for myself to have a chance to do this in a model or in real life. Our students are quite enjoying that. And I think I can't say I can save some people's life in this degree, but I do have confidence to stand out when somebody needs and to try my best to help people when they are in danger or when I need to provide some help or basic emergency life-saving skills to other people. So we try to enrich life for the student, and we also try to let them feel not that lonely when they come to the UK for the first time. Because even though, like I mentioned before, even though you may know some information before you come here, but the difference between these two countries are still very big. For example, the GP systems in China, there's no GP system or the similar concept in the in China. No matter you are feeling sick or you want to sorry, not you want to, but or if you need to have an operation, or if you want to speak to doctor about your worries and concern, you just go to the hospital directly. There's no like a personal medical advisor beforehand. So the GP system or the medical system is quite different between these two countries, and the food and the weather and the driving habits and the education system are just quite different. For example, in China, basically the major universities all are located in the same area and will be have a certain district and area to be called as this university. But in the UK, I think many universities will have different building or different block in different area, like in the city center, in the Myrtle Street, or in different area. And there's no very obvious signal or the district to be called as a university. So it will be like we'll have some culture shock when you first come here. I still remember when I first take to train from Liverpool to Manchester, because in China, when you're traveling between two cities, there will be a notification to remind you which city it is here. But at that time, I remember the station in Manchester are quite a lot, by 3 or 4, and there's no obvious notification for each station at that time. So I'm really confused, like which station I need to take off from my train, and I just take off randomly in one station and ask for help for the people at the station to ask them whether I have the right stop. So. But luckily, there's a very friendly local grandma, I think, to help me to take me to the help center in the station, and the staff tell me the right direction. But what I want to say here is, no matter you know how many knowledges or information about new country, it's a natural thing for a student to feel pressure or feel no confidence or feel unsure when they first come to here to have their study life. And sometimes some people have the habit to fight for the help through the different channel, like through the university, from our association or from maybe medical help. But some students, they just try to stand by their own and not to speak to anybody, even though their parents. So year by year, we can still hear about these kind of cases that the student experience in mental health difficulty from different angles or of a different reason. And sometimes we also feel worried about them because you cannot provide, as a student as well, we cannot provide a very professional help for them. And sometimes because the language because of the language barriers, it is not easy for them to express to what they're feeling and what they're experience in their own language. So in a new environment and in an environment that you need to speak in different language, it will be difficult for them to share their worries and concerns sometimes. So I think the situation is getting better and better now, but still in some days or in nowadays, there are still some students experiencing this kind of stuff now. But I also want to mention, I want to mention the help and guidance we receive from different institutions, different parties, different organizations in the UK or in the Liverpool. Like Chinese Wellbeing, who is also attending today, and Pangoda, that will be mentioned before. This kind of organization also provide many sessions and events and the workshop to help students to know more about the guidance and what they can call for help when they feel difficult. And there are some organizations provide help and support for students to find a job now, because many Chinese students also want to try to have an internship or a working experience in the UK to expand their living experience. But it's just not that easy as you think. So the universities and the different organizations in the Liverpool also provide this kind of training as well to students to explore your career life in the UK. And also our organization from our part also try our best to to help students to encounter any difficulties and provide help that we can have. Sometimes we do sometimes we did experience some cases that we cannot provide anymore so far. So we will guide the student to call for help from maybe number one, or so not number one, the police, or from the NHS, or for other provision organization in the Liverpool or in the UK. And I can see that the promotion about these kind of services and the support are more and more than before, from our email address, from the promotion slogan in the campus, or from the flyer in the libraries or in anywhere the student may come in, and from the welcoming letters in the accommodation. So basically, I think it is impossible to identify the student who's experiencing difficulties beforehand. But I think nowadays in the society, we all together want to tell the student that if you need some help, you can always find some ways to help you to solve the problems. So I think the conditions or the situation were getting better and better. But I think the GP training and the medical basic knowledge section is also necessary for students in nowadays, because some students not familiar about the for example registration for the GP, and then don't know how to do that when they come here. So I hear many students saying that when they have cold or when they're feeling sick, instead of going to hospital to call for help, they just leave with it, to encounter it by their body and their spirit. So this is not encouraged, but I just want to say that it is the reality now. Even though the information, the flyers, we promotion it in our social media and as more as we can, is still some gap between the students and the environment in the UK. So there's still something we can do in this area, I think. And this is like not what this is not what I think they have to do it now, but I think it might be helpful for from different society, different organizations, and different parts of the society to work together to provide environment or provide to be more comfortable for different group or different student to living here. I think the China students group nowadays is very big than what we have in maybe 1988, but still there's more like I think we can do to help them to enjoy in their life maybe 2 years or one is here. So these are some things that I can think of from my personal idea, and yes, I think it's the more about my personal experience and feelings and ideas about how an international student will experience in the UK and what we can do to help them to get it more getting more familiar for this environment and today's like society. Yeah, thank you.
Thank you so much. I mean, that was so relatable because my son started university and he's gone just from one city to another city. So I can't imagine what it must be like for international students to come to a completely different country, different culture and language. But that was, you know, a much needed presentation, and hopefully, you know, the word will spread and we can help encourage them to reach for help. I think that's the message that has been coming right through from our first presenter, that we, you know, that you do need to ask for help and support. Thank you very much. Our next speaker is Hannah Burnett, who's from NHS Green Space and Wellbeing. Hannah, are you there? Yes.
Hopefully you can see my slide. Yeah, good.
Yes.
Yeah, so I'm Hannah Burnett and I am from the University of Liverpool and from the Groundswell Consortium, and I'm presenting today on behalf of myself and my colleague Rebecca. So we've been working on this together. So I'll just be presenting on the Chinese community health and wellbeing with a focus on green space. And by green space, I mean natural spaces such as parks and gardens and sports fields. Next slide. So a little bit about the Groundswell Consortium and where we work first of all. So this is a group of researchers from 9 universities and also partners from the government, industry and the third sector, with some of the logos on this slide representing those partners. So for example, Canal River Trust, the councils, Mersey Forest, and we have 3 city hubs that we focus on. So they are Edinburgh, Belfast, and of course Liverpool. And this picture was just from our annual retreat from the end of last year, where we all came together to discuss our findings and do a bit of network and see each other in person. So I think you might be able to see Selena on there. See that smiling face. So a bit about the project. So this was in partnership with NHS Cheshire and Merseyside. So they led this project around green space and health. So the aim was to improve physical and mental health, especially for priority groups. So for example, ethnic minority groups, disadvantaged groups, and those with poorer mental health. And they went out to local community groups to ask for expressions of interest in this project to deliver the programme. And in the end, 13 groups were involved from across Liverpool City region. And they provided engaging activities in the local green spaces. So for example, visiting, improving or creating new green spaces. And the pictures on the slide represent some of the activities that took place with these community groups. So for example, Nordic walking, which I think Di mentioned in her presentation, gardening and growing, visiting local parks such as Sefton Park, and also ball planting with families and bringing the community together. So the NHS project leads kind of came to us at Groundswell and asked for a bit of support on the data analysis. So we got the data kind of after it had all been collected and anonymised, and then have analysed that data to see what impact it's had on those community groups. And it was funded by the Green Recovery Fund via DEFRA. So just a bit about the data that was collected. So there were survey data collected from 10 community groups with around 538 participants, and these were collected at baseline, so before those green space activities were introduced into the community group in 2022. And there was a follow-up conducted a year after, so that was in spring 2023. So 2 surveys before and after the green space activities were introduced. And the participants were asked about their frequency of green space visits, whether they felt connected to nature, a bit about confidence visiting the green space, their mental well-being, physical activity, and also some demographics, which include ethnicity, which I'll go into a bit more detail in a few slides' time. We also collected, well, the NHS collected narrative reports. So this is from 11 of the community groups, and these were completed by the community group leads. So they were just asked a bit about the community that were involved, some of the activities that took place and the outcomes they expected and that they saw following the activities being introduced. And these reports were then analysed by researchers, so Rebecca and I, a public advisor and the NHS project lead. And we found 3 overarching themes in this analysis. So the impact on health and wellbeing from the green space activities, the connection to nature and taking notice whilst in nature, and then also improved confidence in and use of green space. So again, I'll touch on this a little bit more. So I'm just going to talk, just for this slide, a bit about all the community groups, and then I'll focus in on the Chinese community. So we found from this analysis that the average mental well-being improved after the green space activities were introduced. So it went from kind of a lower mental wellbeing score to a medium mental wellbeing score on average, which is positive. We also found that more needs to be done to include people from with a self-reported disability, because we found that there was a persistent lack of confidence in this group visiting green space compared to those without a disability. We found that some ethnic minority participants, particularly from Asian British background and Black British ethnic groups, reported more confidence in visiting green spaces at a follow-up, so in spring 2023, after the green space activities were in place, compared to white participants. So they are just some of the results from all of the community groups. But as we're talking about the Chinese community today, I'll focus on those participants that were from self-reported Chinese and Chinese British. So they made up 14% of the participants that took place in this project. So there were 76 Chinese or Chinese British participants. And this was actually the second most reported ethnic group after white British, who made up 21% of participants. And I've just put together a few descriptive statistics focusing in on the Chinese community and the impact that these activities had on this community, as well as across all community groups that were involved. So excuse the charts, but first of all, I'm just talking a bit about mental well-being. So you can see that this goes from low, medium to high mental well-being scores, with a higher score meaning better mental well-being. And I've put both kind of all community groups. So the blue represents across all of the 10 community groups that took part in the survey, and the orange represents the Chinese participants in particular. So if I kind of talk through this briefly, so here you can see for the low mental well-being score, if you can see my mouse, that 60% of participants across all community groups reported a low mental well-being score before the green space activities took place, and this reduced quite a lot to 23% reporting a low mental wellbeing score, which is a good sign. And this is a similar pattern shown in the Chinese community here. So 21% reported a low mental wellbeing score before the activities took place, and this then reduced down to 6%. And this pattern is reflected again in reporting a higher mental wellbeing score. So if I focus on the Chinese participants in particular, 20% of the Chinese participants said that they had good mental well-being before, and this doubled to 44% after the green space activities took place. So these results just suggest that having the green space activities as part of the community group had hopefully suggests a positive impact on mental well-being, which I think is a great success. And this is reflected both across all community groups and the Chinese community in particular. So I've done a similar chart here for feeling confident going to green space. So again, the blue represents across all community groups and the orange represents the Chinese participants. So you can see for the Chinese community, before the green space activities were introduced, there was 37% reported that they frequently felt confident going to green space. And this almost tripled to 90%, so the majority, almost all Chinese participants saying that they felt confidence going to green space after they were introduced into the community group. And again, this is reflected in saying that they frequently felt confident visiting green space, which only 10% said after the green space activities had happened. So I think, again, this suggests a positive impact of the green space activities on the Chinese community in terms of their confidence in visiting green space. And finally, just a bit about nature connectedness. So again, they could say they frequently felt connected to nature or infrequently felt connected to nature. So again, for the Chinese community, you can see this increase from 30% saying that they frequently felt connected to nature and increased by a lot to 85%. So again, the majority then felt connected to nature following the green space activities taking place. This is reflected across all community groups and the Chinese community. So this just shows that the project was a success potentially in terms of improving nature connectedness across all other participants and particularly Chinese participants. So just one slide on the narrative report. There are a couple of direct quotes that link to the Chinese community in particular. So one participant has said that walking in the green space and listening to our favourite Chinese traditional songs, old memories came back. And that walking in the green space is what I look forward to every week. With blue skies and white clouds above us, everything in nature invites us constantly to be what we are. Our steps are light as birds and our wrinkled faces are badges of health, happiness and confidence. I think they're both just lovely quotes to emphasise the impact that being out in green space as a community can have on an individual as well as the wider community. So just to wrap up and conclude, we found that we've furthered understanding of short-term and potentially longer-term impacts of incorporating these green space activities into existing community groups on those that are involved, mental well-being, their confidence visiting green space, and also their feelings of connection to nature. And we encourage replicating similar interventions across the UK at a similar level. And I think the findings that I presented emphasize the impact on the Chinese community and the kind of broader Asian community, especially regarding confidence visiting green space and social connection as well. So just quickly to say thanks to NHS Cheshire and Merseyside for leading the project, getting the funding and inviting us to support on the data analysis, and obviously a massive thank you to all the community groups that were involved and allowing us access to their data and reports. And thank you, thanks for listening. I'll stop sharing.
Thank you for that, Hannah. I think being part of Groundswell myself as well, you've emphasised the importance of green space for our mental and physical health, and hopefully everyone can continue to use those green spaces. Thank you very much. Our next speaker is a recording, and it's from Ginger Lou. And Ginger Lou is a public advisor of ARC Northwest, and she's a co-lead of the EPIC team, which is equitable place-based care. Have you got the recording? And just to mention that Ginger is doing a PhD in arts related topic, and her video has been digitally enhanced, so there might be a little bit of a confusion from voice to animation or picture, just to let you know beforehand. Hopefully Ruth can get it up.
Sorry, it's just come up with an issue. Hold on, just be with me a minute.
Okay.
Just sod's law, isn't it? Sorry, let me just go back into the file. It was working fine before. Just bear with. Right. hang on, I think I've got it working now. So just bear with again. Might be able to share again now. I think it might be working. Can you see that?
Yes, we can.
I am second generation
Yes, we
biracial
can hear.
Chinese. My name is something we've had to deal with. When I introduce my name, I always spell it out. My dad taught me how to write the Chinese character of our family name. I have it tattooed on my body. My grandmother was from Cheshire and she married my Chinese grandfather in 1912. He was in England studying at university. Can you imagine a woman from a top family in Cheshire marrying an educated Chinese man in Cheshire in 1912? After his studies, they returned to China where she suffered racism and was often called a foreign devil. They travelled all their lives between England, China and the USA, which is why my dad's family lives all over the world. My dad and my aunt were at university in Shanghai when the Japanese invaded in 1938. Dad became a newsreader on the radio during that time. My aunt escaped Shanghai, but when my dad tried, he was beaten by Japanese guards. After the war and when the communists took over, the family fled to Taiwan, the UK and the USA. Dad went on to teach engineering at Liverpool University. He also taught Chinese and retrained as a draftsman. My aunt lived in the US and my cousins there are 3/4 Chinese. Because of America's racist Chinese Exclusion Act, she wasn't allowed a green card for 10 years. She went on to be the first person to introduce a Chinese language curriculum in Southern California. We traveled together to China and visited the university in Shanghai where they both graduated. She said no other family was like us because everyone lives in different countries. Except when I was a baby, I never met my dad's parents because they lived in Los Angeles and Taiwan. I was born in Los Angeles because Dad wanted us to live there for a while and meet my aunt and her family. I always felt a little different when I was growing up in Southwest Lancashire because I was born in America, and my dad had an American accent and was half Chinese and Ivy League educated and a world traveller. I'm not sure he fit in, but he loved the British culture and our standing in the world. I don't have the same experience as someone who has 2 Chinese parents. I can't possibly compare myself to someone who looks Chinese and who may have suffered racism. But I do have the immigrant family experience, the biracial experience. I travelled and lived all over the world because of my dad and his family's immigrant and migration experience. My dad was born in the UK, so he had the right to be here. His siblings were born in China and the US, and that is why they are dispersed. I love my Chinese heritage because it's my dad's, and I have travelled to China because of it and spent time with my aunt to learn about it. But they also have the immigrant experience and the racism they suffered in the US and probably the UK. My dad had an American accent and was very academic, and he didn't fit in a small village in West Lancashire. We ate Chinese food and he told me how to pronounce tofu and use chopsticks, and he would shop in Liverpool at the Chinese supermarkets. I have my Chinese name tattooed on my body. People think I am Chinese until they see me. I have had shop assistants think I have stolen my bank card because I don't look Chinese. My sister changed her name because she didn't like to be seen as Chinese. My siblings have little interest in their heritage, but my Chinese and immigrant heritage has shaped everything I do in my creative life and my travels. My dad wanted me to travel and experience life, and after he passed away when I was in my 20s, I travelled around China to see if I could experience the things he had, but of course, it was a different China. 10 years later, I travelled again around China, this time with my aunt, and she taught me about my Chinese heritage and filled in the gaps. My dad had written the first part of his autobiography before he died, and he wrote about his first 25 years in China and how he wanted to be British and live British values. I am producing his autobiography to hand out to the family so that they can learn about his Chinese heritage and his international life. I will always be proud of my Chinese heritage because it is part of my dad and my aunt. I've had a lifelong interest in Chinese arts and culture, food and belief systems.
That was so interesting from Ginger, and knowing Ginger as a, I can completely understand when you see Ginger's name, and then you see Ginger. So very, very kind of Ginger to share experience. We have another recording, this time from Janting Chow. Have you got that ready?
I'm just going to get it up ready now. Just have to close one thing down.
It is.
Okay.
And she is an art student, you know, doing a PhD, so you could tell that from the animation.
So this is Ting.
Yeah, so I'm Yan Ting Tao, so you can call me Ting. I'm originally from Shanghai, China, the eastern side of the country, and I moved to the UK in 2021 to do my master degree in Northern Ireland. And then I started working in a care agency in Ellesmere Port, which is in Cheshire West and Chester.
Can you tell us a bit about growing up in Shanghai and what that was like for you?
Yeah, it's a really big city, very, very densely populated, a lot of tall buildings, and maybe just imagine like London, but less diverse. The demographic is mostly Chinese, a lot of, you know, international workers there, but not as much in like London.
What made you think of moving to the UK? Was it the particular course that you were interested in?
Yeah, it's the program that I did because I did a bachelor degree in nursing, and I want to further my study, so I went to Northern Ireland. It's the program that attracts me. It has a clinical element of it as well, so I can do a bit of placement along with my like theory learning. So that's been good.
What so has it been like working in the UK? Have you enjoying your job?
Yeah, I do. I definitely enjoyed it because it's very much related to my study, and I could work more like a nurse, but I couldn't really register as a nurse because of different systems, you know, the one in China and the one here for NHS. So it's a bit different. But I really enjoyed social care, really enjoy adult social care. It's a big area that, you know, people have increased attention to, so that's good.
Yeah, that's good.
Yeah.
And how did you come about becoming a public advisor for the ARC, Ting?
Yeah. So in my last company, I really enjoyed the engagement with different like charities and different organizations. So that was the opportunity that we had with the University of Liverpool, that we did a living lab with them. So it's focusing on the people who live at home but with dementia, and how to incorporate research into social care settings. So that's what we're doing. So that was with NIHR. So that's how I know, oh, actually, that's an organization I could engage with and maybe do a bit more to contribute. So that's when I find, oh, actually, there's a role called public advisor. And I am always enjoying doing volunteering when I was in university in Shanghai or in Belfast. So I really enjoyed them. Another thing is I think participating in research is some of the things I do. Because I was working, I can't really contribute more during, you know, work days. That's probably why. But when it's something as big as like ArcFest, then I will definitely make time to attend, which I did once face-to-face, another time online. So I really enjoyed it. I also enjoy the Public Advisor Forum, and that's an opportunity for people to share, you know, their work.
Can you tell us a bit about if you think you've noticed any health inequalities for the Chinese community in the UK or Liverpool?
Health inequality.
Yeah, is there, do you think there's anything that makes it difficult for people to access healthcare maybe, or?
I think one thing I noticed when I was in university is that people don't really know how NHS works. Because I mean, you know, if for someone who already live here for decades or even born here, you wouldn't think otherwise, but it's really different. It's something that is really one of its kind. So for new students or people who just coming or, you know, new immigrants, it's something that really need some support and navigation for. That's one thing I would definitely say. They don't know like how to register, what is GP, and yeah, it's just a very new concept for me, even when I first came. So I think that's one thing. And also, I suppose it's like an inclusive approach for people who may not speak that much of English. If there are you know, language like materials in different languages that could be helpful. And also I was thinking about some services I actually didn't know they're existent. Some certain like checks and vaccines, I didn't know they're actually accessible for free. So that's why actually I pay for it. And then later I realized, oh, actually,
Could have
whoops.
got that.
Yeah, I couldn't get it for free. But yeah, you know, things like that. If I know better, if I know more about what is provided, that would be great. Yeah.
And do you think have you seen anything that you think researchers should be looking into or should know about working with people from the Chinese communities?
I think one thing is the belief that we can heal ourselves with some hot water or, you know, herbal medicine. That's really true. So that's something I think when you know, it's just a mild cold, it's probably all right, you know, just have trust in your own immune system. But when it's something actually could lead to something really serious, then it's that belief also, you know, delay the treatment and the diagnosis. So I think that's something need to be looking into, and I suppose engage with the community and try to encourage them to take up certain tests when they reach certain age. I think that's something would benefit them, because otherwise they wouldn't do it. Yeah, it's always like have a bit of doubt and maybe do a bit of research ourselves and then go to the doctor and say, actually, I think I am this, but maybe it's not. So I'm probably just talking from my point of view. It's just my family, my wider family. That's definitely a thing. Yeah, I think that's definitely the big one. Yeah.
And then do you feel like you combine your the knowledge that you've got from your degree with like your cultural heritage as well? Do you think it affects how you think about your work, or does that make sense?
If
Not
you could
really.
try again. Thank you.
Yeah. I guess I just think, like, from what you've seen around social care in Shanghai in China, and then what you've seen here, like, do you feel that we could learn lessons from each other about how we care for maybe people? And
I think, yeah, that's actually a really good question. So when I was in Shanghai doing my placement, and we do have community nursing, and at the time my parents actually brought me to a retirement village. It's something that you can see here as well, but the one in Shanghai was just posh. What I mean by that is everything, you know, the hardware, it's really good. You know, all the beds that can actually turn and make it easier for carers to reposition the users. That's already there. There's also, you know, a lot of these like telehealth devices already in place. They brand themselves as, you know, like medium, like average to better, you know, like above average kind of service. So I think that in terms of hardware, they're doing really well. But I think something that we can definitely learn from the UK system is, I suppose, it's the software, it's the staff, it's the workforce. I think it's the caring approach, and that I think it's something definitely in the Chinese, you know, industry needs more investment in, because you need these trained, excellent staff to deliver these quality care, to really make use of these devices, rather than just having the high quality ones but sitting in the corner. So I think it's probably a combine of both, you know, good device and, you know, these equipment for the health of our staff, but also to improve quality of life for the users. So yeah.
Thank you. That's very interesting. Trying to think, is there anything else that you wanted to talk about that we haven't covered?
I just want to say it's a brilliant idea to have the Seldom Heard Forum, and really happy to have Chinese community as part of it. I think, you know, the engagement, the opportunity to engage the community. I think this is a perfect example to do some work like this. So yeah, just want to say thank you, and yeah, thank you.
Thank you for that, Selena and Ting. That was really nice. I think it's been a really good forum today, and we've had such diverse presentations from all generations. We've got a few minutes left for question and answers. Would anybody, hopefully people are still here with us. And we've still got some of our presenters as well. I can see Des and Hannah. Di, are you still with us?
Yeah,
Yeah.
yeah, still here.
Yes. Selena, would you like to kickstart?
Yeah, I just wanted to say thank you to all our presenters. I think it's been a really fascinating day. Does anyone have any reflections or questions in the audience?
I think
Yes, Di.
Di's got a hand up, and
Oh.
Joan.
Okay, Di first, then Joan.
Okay, thank you. Brilliant, absolutely brilliant session. Thank you so much for inviting us to be a part of it. I noticed there were a couple of questions in the chat, and one was related to when we encourage people to go to talking therapies, why they didn't finish the course.
Mm-hmm.
The biggest reason for that was reported to us was that they felt it very difficult to talk about their emotions in front of an interpreter. There was no bond or trust with the interpreter. And talking to our member of staff, our mental health lead, and she spent many, many hours with each individual because we were dealing with them on a one-to-one basis. They felt relaxed, they could talk in their own language, and they also knew that our mental health lead understood from a cultural perspective. But the talking through an interpreter, no one liked. And that was the reason they packed it in after about 2 or 3 sessions. And they just said, we can't do this. So that was that. The other question was, do Chinese carers recognize themselves as unpaid carers? Not really. No, they don't. And if you ask a lot of carers, and I do work closely with dementia carers, no one regards themselves as an unpaid carer. So, and that's a same applies to the Chinese community. And I don't think, and are our carers, do they find their way to the carers centre, or are they referred to carers support services? No, there's a language issue. We've been in social care for many, many years. We were rated outstanding by CQC for 7 years. And we had to come out last year, and it has been touched on in some of the presentations about the importance of health equity, reducing sort of inequalities in health and social care. We did that. All our staff, I'm the only non-Chinese, okay, and all of our staff, and last year we had 35 Chinese staff. So it's now reduced because we had to pack in, unfortunately, after battling many years with the economics of providing social care commissioned by the council through the commissioning service system, and we had to pull out because if we'd have stayed in it, and there was a great need in the community, it's still there, but if we'd have continued, I wouldn't be here today giving a presentation about Chinese wellbeing. We would be history. So that's the unfortunate thing. And access to the carers voucher scheme was always through Chinese wellbeing. When we did our risk assessments, when we did our healthcare needs assessments, we did a holistic view, not just of the person requiring the care, but of their family and their carers. And we looked at it from a very sort of family perspective. So Yeah, I just wanted to, because I'd noticed them in the chat.
No, thank you,
That's
Di. Our last forum was about carers, and amazingly, we did have somebody from the Chinese community reach out. You know, and I think it really is important for, you know, anyone even on this session today, that we have got a carer centre, and it is important to get that help. We
Absolutely.
have, who's our next one?
I
We
think
have
it's
had a
Joan
request
and
from,
then Lily.
and then Lily, yeah.
Joan.
Okay, Joan.
You're on mute.
Okay. I'd just like to share with everyone that there's a project underway. It's for unpaid carers who are caring for loved ones. It's accessible to everyone from every culture in the Cheshire Merseyside and further afield, I think. It's at Ince Blundell Hall. Unpaid carers can go there. You can spend a weekend there, a week there, or a day there. They're looking to recruit people to do activities. The grounds are massive. The residence is as stately as a Georgian, it's from the Georgian period. It hasn't been changed. Its characteristics are amazing. There will be a chef. There will be Tai Chi yoga in the grounds. There's a lake. So I will send this information to Ruth, and hopefully, Ruth, you can share it with everyone. But what I'm thinking is, what would be lovely would be if people from the Chinese community and other communities get involved, you know, in the cultural side. So the chefs, you know, introducing Chinese cookery, Chinese art. Let's make it so that we you know, as unpaid carers for now, we can all integrate with unpaid carers from the community, learn, you know, and speak to one another, and hopefully, you know, bond and start learning from one another. So I think if everyone wanted to get involved in it, I think that would be fantastic to bring all the different cultures into into this project, and it would give everyone a chance to get to know one another, learn about all our cultures, and hopefully break down a lot of barriers.
Thank you, Joan. That is a brilliant idea. It's definitely something I'll be on board for as well.
Okay.
Yeah, thank you. If you can send the details to Ruth.
Yes, I'll send it on.
We're just going to hear from Lily, who wants to tell us about another community-led project. Are you there, Lily?
Thank you so much. Hi, everyone. Thank you so much for having me along. I'll be really brief. I was hoping to share my screen just to show some visuals. So I'm hoping it works, but let's see. So I'm based at the, can you see my screen?
Yes, yes.
Fantastic. So I'm based at the University of Oxford, but we've got partner institutions and local charities across the UK, and one of the hubs being in Liverpool, actually. And we are looking at optimizing cultural experiences for mental health in underrepresented young people online. So that's the name of the project, Origin. And the reason why we do that is because we know that 50% of mental health problems start by the age of 14. And this sort of young person demographic is actually the least likely to receive or seek out mental health support. And especially people living in the UK from an ethnic minority background, we know from the research, are even least likely to reach out for support. So with Origin, we've got funding for 5 years through the NIHR to co-design with 16 to 24-year-olds this online arts and culture intervention to help with anxiety and depression. And we are currently recruiting for 16 to 24-year-olds from very diverse backgrounds. And we would love to have some representation from people from the Seldom Heard Forum, especially if there are people here who have networks with the Chinese community. It would be super duper to hear from their experiences. I mean, the research itself is actually quite similar to some of the stories that you would have shared, and it's I'll just skip through to to the part where I'm sharing about the study and how to get involved, to keep it brief. But effectively, we offer the opportunity for anyone living in England who's 16 to 24-year-olds and is currently experiencing or over the past year have experienced a mental health problem to share their story. And we've now done almost 60 of these interviews and have found from the feedback from the young people, especially from ethnic minorities living in the UK, that they found it quite empowering to be able to have their story shared and listened to. So I'll share the links, and I would really appreciate if you could share this opportunity through your networks. There's compensation for the £40 compensation for people taking part in a roughly 1 hour long interview. So any questions, I'll share my details and the link. Thank you so much for having me.
Thank you, Lily, for that.
Thank you. Brilliant. Lily, can I just ask you, do people need to have been born in the UK to take part, or can like international students be involved?
Absolutely not. That's actually what we're very much looking for, just people living in the UK right now and their diverse experiences of what that's like.
Okay,
yeah.
Brilliant. That's great.
Thank you so much, everyone. We're just a minute over. Thank you to all our presenters. I hope you've also enjoyed the other presentations as well as listening to the whole forum, and we look forward to seeing our future forums as well. Any last comments from Selena, who's also our public advisor lead?
So we'll follow up after this meeting with probably an evaluation form, but also any kind of details that you want to give out about your organisations or any initiatives that you want support with or to get people involved. And also if any researchers want to contact your organisations, we'll be able to pass that on as well. So just again, to mirror what Nahid said, just thank you so much for coming today, and sorry we're 2 minutes over, but I think we all learned a huge amount from each other today, so just really enjoyed it, and thank you very much, and have a great day, everyone.
Thank you.
Thank you.
Thank you.
Bye.